Can a thyroid ultrasound tell if a nodule is cancer? This is one of the most common questions after a scan. Many people ask, can ultrasound tell if thyroid nodule is cancer? Or does a thyroid ultrasound show cancer, especially when the report uses words like suspicious, solid, or microcalcifications? The short answer is this. A thyroid ultrasound gives important clues, but it usually cannot confirm cancer by itself. In this video, I'll explain what ultrasound can and cannot tell you, which thyroid ultrasound cancer signs raise more concern, how TIRADS in thyroid ultrasound helps estimate risk, and when biopsy or follow-up is really needed. So if you are trying to understand a suspicious thyroid nodule on ultrasound, this will help. First, think of ultrasound as a risk assessment tool. It shows how the nodule looks, not what the cells actually are. So if you're wondering, can a thyroid ultrasound really tell if it is cancer, or can an ultrasound confirm thyroid cancer? The answer is usually no. It helps estimate risk, but it does not make the final diagnosis. Good. That is why learning how to read a thyroid ultrasound report is so useful. Ultrasound shows the size of the nodule, whether it is solid or cystic, how dark or bright it looks, whether it is taller than wide, whether the margins are smooth or irregular, and whether there are any suspicious lymph nodes in the neck. Some findings raise more concern than others. A nodule may be more suspicious if it is solid, very dark, taller than wide, has irregular margins, or contains tiny bright spots called microcalcifications. These are warning signs, not proof of cancer. Patients often ask, what does solid thyroid nodule mean? What does hypoechoic thyroid nodule mean? And what do microcalcifications in a thyroid nodule mean? A solid nodule is generally more concerning than a purely cystic one, but many solid nodules are still benign. Hypoechoic means the nodule looks darker than the surrounding tissue. Microcalcifications can be important because they are more often seen in papillary thyroid cancer. Another common question is, what does irregular margins mean in thyroid ultrasound? Or what does taller than wide thyroid nodule mean? Both of these features can increase suspicion, but none of them alone can prove cancer. So, does suspicious thyroid nodule mean cancer? No. It means the nodule deserves closer attention, not that cancer has already been confirmed. This is where TIRADS becomes useful. If you have asked, what is TIRADS in thyroid ultrasound, or wondered about TIRADS meaning in a thyroid report, it is a scoring system that helps doctors estimate how suspicious a thyroid nodule is. It looks at composition, echogenicity, shape, margins, and echogenic foci, then places the nodule into a category based on the total score. A higher category gets more attention, but does high TIRADS mean cancer? No. It means the estimated risk is higher, and it helps decide the next step. That next step depends mainly on appearance and size together. So when should a thyroid nodule be biopsied? That is where TIRADS biopsy criteria for thyroid nodule become important. Doctors do not biopsy every nodule. They look at how suspicious it appears and whether it is large enough to justify sampling the cells. So, does every suspicious thyroid nodule need biopsy? No. Some suspicious nodules are too small for immediate biopsy, and many lower-risk nodules can be safely watched. That is why the decision is often thyroid nodule biopsy or follow-up. not automatic biopsy for every patient. If follow-up is chosen, people often ask when to repeat thyroid ultrasound. During follow-up, doctors are not just watching for growth. They also look for new suspicious changes, such as more irregular margins, a more suspicious shape, new punctate bright spots, or suspicious lymph nodes. That is the real thyroid nodule follow-up scan. Meaning, when you read your report, focus on the TIRADS category, the size of the nodule, whether biopsy is recommended, whether follow-up is advised, and whether any abnormal lymph nodes are mentioned. These details matter much more than reacting to one scary word. And that leads to another common fear. Thyroid ultrasound reports scary words explained. Words like suspicious, solid, hypoechoic, irregular, or microcalcifications may sound alarming, but they are risk description terms. They do not prove cancer by themselves. So, what happens after suspicious thyroid ultrasound? Usually, the next step after thyroid ultrasound is either biopsy or follow-up imaging, depending on the size and ultrasound appearance of the nodule. Ultrasound is the beginning of the decision-making process, not the final answer. The most important message is this. Thyroid ultrasound is very good at estimating risk, but it usually cannot tell with certainty whether a nodule is cancer. Many nodules that look worrying still turn out to be benign. The goal is not to panic. The goal is to understand the risk, choose the right next step, and make decisions calmly with your doctor. If this helped you understand your report more clearly, please subscribe to RRJ Health for more simple, patient-friendly explanations.